You know, for decades, radiology has kind of been the invisible engine of medicine. But right now, it is at the absolute heart of a massive technological revolution. We're about to explore a debate that could genuinely change healthcare as we know it.
So this is the big one, isn't it? Will AI just flat out replace radiologists? Or is something else going on? Something more like a total redefinition of the job? It's this high-stakes showdown, tireless algorithms versus decades of human expertise. Today, we're going to unpack this whole thing, not with all the hype and fear, but with a clear, focused look at what's really happening.
Okay, so first up, let's make the case for the challenger, artificial intelligence. The argument for AI is incredibly compelling, and it all starts with one fundamental advantage that machines have over people.
And right here, this is AI's superpower. Consistency and endurance that are just, well, they're superhuman. Think about it. It doesn't get tired after a grueling 12-hour shift. It never needs a coffee break, and it's not going to miss some subtle little finding at 3 a.m. It can analyze thousands of scans in the time it takes a person to carefully review just one.
And this isn't science fiction, okay? This is happening right now. In really crucial areas like mammography screening, finding tiny lung nodules, or identifying brain bleeds on CT scans, we already have studies showing AI performing at or even above the level of human experts. This isn't just a small step, it's a major disruption.
But that's only half the story. Now we've got to turn to the human side of the equation, because reading a scan is about so much more than just spotting pixels on a screen.
This one phrase, it gets right to the heart of the human argument. Detection is not diagnosis. An algorithm might be fantastic at finding an anomaly, but you need a doctor to understand what it actually means for the patient.
You see, diagnosis is a deeply cognitive process. It's about weaving together the patient's entire history, recognizing subtle patterns across maybe different kinds of scans, and then, this is the most important part, communicating what to do about it to the rest of the medical team. That's the real art of medicine.
Let me give you a perfect example. An AI and a human both spot a small nodule in the lung. The image is identical, but for the human radiologist, the story is completely different. In patient A, a 65-year-old smoker, that's a huge red flag. In patient B, a 25-year-old non-smoker, it's probably nothing to worry about. Same image, but the context changes everything.
All right, so we've heard the arguments for both sides of the aisle. Now let's put them head-to-head in a direct comparison to see exactly where each one comes out on top.
As you can see here, AI is an absolute master of high-volume repetitive stuff, screening, getting precise measurements, flagging emergencies. But it really falters when it gets a curveball. We're talking rare diseases it's never seen, anatomy that's been changed by surgery, or just messy, poor-quality scans from the real world.
And this leads to a massive, unresolved question that goes way beyond the tech, and that's accountability. I mean, medicine isn't just about being right, it's about taking responsibility. If an AI misses something, who's on the hook? The doctor? The hospital? The software company? Nobody has a clear answer for that yet. So, given all these strengths and all these weaknesses, the whole story is starting to shift. The future probably isn't about AI versus humans, it's about something way more collaborative and way more interesting.
This quote absolutely nails the new consensus. It's not about radiologists being replaced by AI. It's about radiologists being replaced by other radiologists who use AI. See, AI isn't an enemy to be fought. It's a powerful tool that needs to be mastered.
So, what does this teamwork look like in the real world? It's a hybrid model. The AI was a first pass, you know? It handles all the heavy lifting of finding things and measuring them. And that frees up the human radiologists to focus on what they do best, the deep thinking, the interpretation, and making that final, critical decision.
A great way to think about it is this. The AI becomes a second set of eyes on every single scan. It's like a partner who is always on, always alert, and who might just catch something that could otherwise be missed. It makes the human expert even better at their job.
So all this change has huge implications for anyone who is a radiologist or is even thinking about becoming one. The job isn't going away, not by a long shot, but the job description, that's getting a major rewrite. So if you want to thrive in this new world, you have to double down on the skills AI can't copy. That means deeply understanding clinical medicine, not just looking at pictures. It means becoming a true subspecialist. And of course, you absolutely have to get comfortable with using these powerful AI tools.
And this is really the ultimate takeaway. We are not watching the death of a profession. We are watching its rebirth. AI is forcing an evolution. It's stripping away all the repetitive work and elevating the radiologist's role to be more about thinking, more integrated with the care team, and ultimately even more valuable to patients.
So, we end up back where we started, but with a totally new question. It's not if AI will change radiology anymore. That ship has sailed. The change is here. The real question is a human one. Will the professionals at the heart of this field adapt, learn, and evolve fast enough to lead this revolution instead of just being led by